Thanks for joining Hollywood Doc Show. Today we have a next episode with our new, very prominent doctor from Los Angeles area. As you know, the COVID season is still behaving pretty much everywhere, and Los Angeles is very highly affected. So we decided to invite our new guest, Dr. Suzie Bash. She is practicing neuroradiology, and she is the medical director of RadNet, which is one of the largest service provider in the Los Angeles area. Let me tell you more detail about her. Dr. Bash, she did her bachelor degree from University of Illinois at Urbana-Champaign. After that, she went abroad and studied for a year, and then came back and joined the medical school in University of Illinois College of Medicine. She completed her MD degree from there, and then decided to join the internal medicine residency program at UCLA, University of California at Los Angeles, and then did her neuroradiology fellowship from the UCLA. Currently, Dr. Bash, she is working at RadNet. She's the medical director of neuroradiology. She has a very unique specialty in AI. Today, we want to discuss with her more detail how we can use the AI with manage the COVID. As you know, COVID is pandemic. It's pretty much everywhere. People are working on, the scientists are working on to get the vaccine ready, and also we have advanced treatment, but still it's a big challenge to deal with the COVID. So we thought we should invite Dr. Bash to come and let's talk about it and see what she's been doing with her patient. So please welcome Dr. Bash. Hello, Dr. Bash. How are you?
I'm doing great. Thank you so much for having me.
Well, welcome to the show. It's my pleasure to have you on the show, and really thank you so much. I totally understand how busy your schedule is, but really we are honored you in our program, and explaining more detail about what's going on, especially the neuroradiology and the COVID thing. What's going on in LA regarding the COVID? I heard the cases are so bad these days.
Yes, well, unfortunately, LA is a COVID hotspot. But having said that, I'm actually quite impressed with mask compliance in the city, at least in the neighborhoods that I'm in. And it seems like people are really making efforts to be socially responsible and maintain a distance. But I mean, obviously, it's clearly affected all of our lives. And, so it's, and I think it's going to be around for quite a long time.
Oh, okay. So, Dr. Bash, over the course of the pandemic, we have seen an evolving range of clinical manifestation of COVID-19. I know you have a specialty, which is neuroradiology, very advanced neuroradiology, mean artificial intelligence, and further. We definitely wanted to know what neurologic signs and symptoms are associated with the disease.
Well, yes, that's a great question. And actually, neurologic symptoms are actually quite common with COVID. So about 1 in 3 people that are COVID positive will manifest some kind of neurologic symptoms. Now, that may be something like a bad headache or anosmia, where you lose your ability to smell. Or it could be things like confusion or dizziness or ataxia, and sometimes even very severe neurologic symptoms like seizures or even stroke. Now, stroke has always been a very big health issue. It's 90% of strokes tend to be ischemic due to a blood clot, and about 10% hemorrhagic. But what we've noticed is there has been a big increase in strokes since this COVID surge. And strokes in young people between the age of 30 and 50 have actually gone up by about 7-fold since the COVID pandemic started. So it's really quite remarkable. Strokes are the 5th leading cause of death in the United States and the 2nd leading cause of death worldwide. And they're the number 1 cause of disability. But the big question is why are we seeing all these increased strokes in this, COVID pandemic?
Yep.
And the answer is really blood clots. This COVID virus is causing an increased number of blood clots.
Okay.
And the reason why has to do with the mechanism of how the virus invades our bodies. So, COVID gets into our bodies through direct contact with the mouth, the nose, the eyes, or through respiratory droplets. and then invades our cells through ACE2 receptors, angiotensin converting enzyme receptors. And these cells are basically, these receptors are located on a lot of our organs, like our heart, our lungs, our intestine. But importantly, they're located along our blood vessel walls. So what happens is the virus directly invades into our blood vessel walls and incites this prominent inflammatory response. And then that disrupts our sort of very delicate clotting cascade balance, and it results in blood clots. And this can actually happen anywhere in your body. I mean, if it happens in a deep leg vein, we call that a deep venous thrombosis, a DVT. If it happens in an artery that's in your lung, we call that a pulmonary embolism. And actually you can die of PEs. It's a very serious thing. You can't breathe. And then if it happens in the heart, it could result in a heart attack. And if it happens in a blood vessel that supplies the brain, that would result in a stroke. And we're actually finding a very interesting phenomena, but this COVID virus seems to preferentially affect the large vessels in our brain. And so instead of the small strokes that we see so commonly as people age, we're getting a lot of these big catastrophic strokes. And actually, if you were to get a stroke with COVID, it has a very high mortality risk. It's about 63% or something. So it's quite high. And so dealing with stroke is a very important issue, and it's something that we have to be very aggressive about. And in terms of these blood clots, you may be wondering, what are your chances of having a problem with blood clots if you do get COVID? And the answer is about 1 in 3 people do have problems with blood clots if they have severe manifestations of COVID. And so we're now actually recommending anticoagulation for all patients that are basically need to be hospitalized with COVID. These neurologic things it's a really big deal. In fact, if you do an MRI on someone with severe COVID symptoms, you have a 44% chance that MRI is going to be abnormal. I mean, it may show strokes, or it may show changes in the subcortical and cortical regions, but it really has to do with this thrombotic angiopathy that's going on.
Yeah, really, that means, so what do you think, like a stroke only, or the kids also, they have the similar issues? I know the kids and the stroke is 2 different topics, but I just wanted to know if the pediatric patient also comes with the DIC sort of symptom, or do they have like a clot? Is that right?
That's correct. So COVID manifests in different ways and like I said, not everyone gets problems with clots, but another part of the component that we're seeing in the pediatric population is what we think is almost sort of an autoimmune, like the inflammatory change by the virus is causing the body to sort of overreact, and you end up getting this big inflammatory syndrome that you see in the pediatric population. And this is on top of course, all the different respiratory symptoms that people can get as well. So the bottom line is, as this pandemic is unfolding, we're seeing that it's affecting multiple organs, multiple different areas of the body in different ways.
No, okay. So my next question is, how has the pandemic affected people's response to acute emerging neurologic symptoms? How can doctors help improve clinical outcome through patient education?
Yeah, so patient education, I feel, is actually extremely important. So we now have clear evidence that patients are delaying calling 911, for example, if they're having an acute stroke. There's been several documented cases of that. And we just really that's something that we really have to avoid. And the best way, I think, to remember it is just to try to remember the signs of an acute stroke, because also, since we're folding in younger people now into our regular stroke population, these younger people are, when they have these sort of symptoms, they may not be realizing it's a stroke because they're not in the normal target age for stroke. Stroke can happen at any age, but we've actually dropped our stroke age of initial incidence by 15 years since COVID has started, just because both young people and older adults are getting, blood clots. So a good mnemonic to remember is be fast. The B stands for balance, sudden onset balance difficulties. The E stands for eye, sudden onset visual change. The F stands for face, facial drooping or asymmetry. The A is for arm, arm weakness. The S is for speech, any alteration in your speech pattern. And the T is for time, a reminder for how important time is. for every 1 minute you go without blood flow to your brain, you actually lose 1.9 million brain cells. So literally time is brain, and it's absolutely critical for calling 911. And when they've asked some of these young patients why they didn't call 911, their initial response was like, well, I knew something was going on, but I don't want to be brought to a hospital where there's a bunch of COVID patients and I may contract COVID. All the while having no idea that their stroke was actually probably being caused by the COVID virus. And so, no matter what your health condition is, if you're experiencing serious medical condition or serious medical symptoms that you're not aware of, you need to call 911 and seek treatment right away. And the other aspect to remember is that, strokes, about 80% of strokes are actually preventable. Now, there are some non-modifiable risk factors like age and family history. Family history is a very important risk factor, but there are other risk factors that are modifiable. So, for example, atrial fibrillation, that's an irregular heart rate that you can get. That's a 5-fold increase in stroke rate, and that is something that actually can be treatable. Another thing is blood pressure. Blood pressure is the number one cause of stroke traditionally.
Which is very common, like in every person.
Yes, exactly. And that's something you can't feel, so you just have to get checked regularly, and that's easy to treat. Another thing is cholesterol. You want to make sure your cholesterol is under 200. And again, that would be something you test through a blood test on your yearly exam. And then diabetes, if you have diabetes, to make sure that that's staying under control. Another thing is to get a good amount of exercise and maintain a nice weight, and to stop smoking. If you're a smoker, smoking is a 2-fold increase in stroke. And then also want to avoid excessive drinking, and cocaine also is an increased risk for stroke.
I know you do a lot of work in artificial intelligence. So my next question is, the artificial intelligence is a very hot topic these days. You name the medicine, you name the field, it's there. Artificial intelligence is making a revolutionary changes in the field of medicine. So what do you think, how it is playing a role in medicine during this pandemic?
Well, I think artificial intelligence is playing a very large role during this pandemic. It's actually really amazing what's happening. All the great minds coming together in these different AI companies working collaboratively to help fight this disease. Artificial intelligence is a computer-generated neural networks that are meant to sort of mirror the intellectual thought process of a human being. And it can really be used to augment human capabilities. Computers are very good at analyzing large volumes of data, and that can be used to recognize patterns. Actually, computers are better than humans at recognizing patterns. And deep learning is sort of a form of machine learning, a subset of AI that employs these convolutional neural networks, and it's shown to really have great potential in medical imaging applications. So AI is really the future of medicine, but it's not really just the future of medicine, it's really the future of all industries, because it can really enhance accuracy and efficiency and add value. So the AI healthcare community has really exploded with ideas aimed at combating the COVID pandemic. And the amount of innovative AI adaptation to this crisis has really been remarkable. And if you want, I can give you a few examples. So for example, one company that I work with, Icometrics, has in a very short amount of time and with other collaborators has come together, and using a deep learning product, they've come up with a product called Ico Lung. And that will quantify the amount of COVID lung disease. It will actually categorize the type of lung disease. We see different certain patterns with COVID. So it will tell you what volume of lung disease there is, what percentage, and where it's located in the lung. Okay. And that can then help triage patients that are admitted to the hospital, whether, can help in the decision of whether the patient may need to go to the ICU or can be treated on a floor bed. And they are actually offering this software free of charge in the United States and Europe. So it's really incredible, the benevolence of these companies who really just want to help during this pandemic. Cure AI is another company that has a sort of similar product, but that analyzes chest x-rays. Same thing, it quantifies the amount of lung disease, and that can be done right at the bedside for the patient. So it's a very useful technology. They also have a Q-Scout application, and that allows tracing of contacts, and it sort of auto-generates hotspot maps. And so it can be very helpful in that regard. There's a product, an app called DP3T, which does contact tracing using Google and Apple's API.
Okay.
And that employs sort of encrypted Bluetooth technology. And that can also track contacts and communicate anonymously with other cell phone users. And so if someone tests positive for COVID, it can actually send out a Bluetooth alert, alert through Bluetooth and anonymously. And then that person can be given information about where to test and to further pursue.
Okay.
Another AI company, Cortex Labs, is offering totally complimentary COVID reports. They're a quantitative volumetric MR company, just like Icometrics is as well. But they're offering these complimentary reports with lesion quant in the brain. And so it can track brain changes that you can get. As we said, 44% of the MRIs are abnormal in patients with severe COVID.
That's great. Seriously, it looks like there are so many companies are already in, and they're bringing a new innovative technology. So do you think, is there any hope for, let's say, if we use this for the early detection, do you think it make a difference? Detection and the early detection based on these and AI companies, whatever they are, what the product they are offering, do you think it will affect?
Yes, I mean, the bottom line is AI everyone has kind of heard the term now, everyone's sort of bantering about, but truthfully, it's here and it's here to stay. And because of the COVID pandemic, it's sort of accelerated research and acceptance of some of the things that AI is doing. I mean, I envision a future where AI will be applied to every radiology exam. In the past, people talked about, AI may replace radiologists. I believe that they have a very synergistic relationship. I don't think they will replace radiologists, probably at least not in my lifetime, but it can really help. So certain things like, for example, Subtle Medical has a product called Subtle MR, which can allow you to accelerate image acquisition by about 60%, but actually maintain or actually improve the image quality. This is the type of thing that can help in the post-COVID era as we start to see a resurgence of imaging. As I said, a lot of people have been kind of delaying getting imaging because they're worried about contracting the virus in imaging centers. But the truth is I would encourage people not to delay imaging if you need it, because your health is the most important thing that you can do. And imaging centers are really working hard in that regard to keep you safe as you're getting imaging. But certain AI products like that can really help move patients through quickly and accommodate the volume resurgence that we're going to see as sort of we get more control of this pandemic.
So you mentioned a lot about the COVID thing. What do you think, how far we are in terms of the other diseases like the artificial intelligence? Do you think we are moving, just talking about the cancer, or maybe a neuro disorder, or maybe any abnormality within the body, you think, or maybe MSK kind of other musculoskeletal diseases? What do you think the role of the artificial intelligence in those kind of areas? Because the COVID, as you mentioned, there are so many companies, they are already involved. In fact, of course, we are in a pandemic situation. The entire world is suffering. We definitely need to be more focused to treat the COVID. But definitely I wanted to know more about, as you said, the role is more synergistic. So do you think this synergistic role could be applicable to the other diseases as well?
Oh, absolutely. In fact, I have been using artificial intelligence in my routine clinical neuroradiology practice for 12 years now. And this is not some kind of experimental thing. This is something I actually use on a daily basis. So, for example, I use quantitative volumetric MRI. We use a company, Cortex. We also work with a company, Icometrics, and we apply that to patients that have dementia or seizures, multiple sclerosis, traumatic brain injury. There are a lot of indications that this can be very useful, and it really eliminates that subjective component of the exam. So, for example, if a patient had dementia, when I'm reading the MRI report, I might say moderate cerebral atrophy with a temporal parietal predilection. When the neurologist gets back my report, that's a red flag for possibly developing Alzheimer's, because that's a sort of a pattern that you get with Alzheimer's disease. But another person may call it mild atrophy commensurate with age, which would not raise a flag for dementia. And so applying an AI technology like quantitative volumetric MRI, it levels the playing field and actually compares that patient's degree of atrophy to a large normative database, so you know whether that atrophy is statistically significant for patient age. And it also helps you recognize the patterns between the different dementia syndromes. We use it for multiple sclerosis. It will actually count the number of lesions for you or tell you the volume of plaque burden. And it's great for longitudinal analysis because, again, it's an objective measure of the volume of plaques. So it's much easier to see when they come back if you're progressing over time and you may need to do drug modulation. So there are a lot of things we use it for. Another thing that's very low-hanging fruit in the future will be neuro-oncology applications, because it's actually, you would think it'd be very easy to measure as the patient comes back each time whether the tumor has slightly grown or not. But the problem is there's differences in slice sampling and head angulation. And it's critically important to know whether that tumor has grown or not. As a neuroradiologist, neuro-oncology is bread and butter of our work, but we really need to be accurate. And so again, quantitative volumetrics are very applicable. Other things that, again, that I see in the future, and actually the major vendors are all starting to develop deep learning algorithms to do this. But again, that, as I talked about, that image acceleration while improving image quality. And then companies like Subtle would be vendor neutral, whereas the other major vendors would be specific just to their magnet. But again, I think that will definitely become part of standard of care in the very near future. And for hospitals, I think the triage apps that automatically detect the intracranial bleeds, etc., are going to play a major component. And even though I've mentioned the neuro, the same discussion happens for all organs in the body. We're now using artificial intelligence to detect breast cancer earlier, and it's really, Curemetrics is a company that does that, and they've shown that they're actually better than radiologists in some cases with detecting breast cancer. So again, I think this is something that we're just going to see more and more of as time goes on.
So it looks like we are heading toward more robotic and more engineering, together, like with the doctors and the physician and the radiologist. So as you know, we are providing a limited service nationwide. But I noticed RadNet is doing pretty good job. Dr. Berger team and you have Dr. Suzie Bash, you are one of the neuro director, and your other board of director, Dr. Norman Hims, they are just doing an amazing job, especially when I'm talking about the RadNet. You have one of the largest, I would say the RadNet is one of the largest imaging service provider in the world. And you have a good number of staff. How are you managing in this COVID situation when nobody is really able to provide the full service? But RadNet, they are basically now emerged as the leaders providing the service in this pandemic situation. What is going on? How you are managing this situation?
Yeah, so obviously it's a big issue because the RadNet enterprise is very largest outpatient in the U.S. And we're doing several things. So first of all, RadNet has taken the pandemic very seriously. And so they've employed a lot of measures to really keep their patients and their staff safe. So I really feel that they've gone above and beyond in terms of patient safety. I mean, our staff is obviously fully masked. We're cleaning and sanitizing the imaging rooms before and after every single patient, obviously wiping down the waiting rooms. We've now employed the ability for patients to check in curbside from their car, just right off their cell phone. And then someone will, a masked staff person will go out and meet them at their car window and let them know, okay, now we're ready to bring you back. So they actually bypass the waiting room altogether. They can just head directly back in and get their imaging, which is fantastic. Obviously, we check temperatures and things like that. And then one of the AI companies that we work with, Ezra, actually is doing some special things with COVID. They're allowing people to actually get testing for COVID if they want, right there, sort of an instantaneous test. So I really do feel that RadNet's done an excellent job in coping with this pandemic, and also, again, encouraging people to not deny imaging needs when a health issue comes up, but really if they need to get imaged, please to go ahead and get that imaging done.
Definitely, and we need Dr. Berger to suggest to our governor as well, so then they can follow some special instruction, for the California resident. But for sure, the next, Dr. Bash, I really don't want to take your too much time, but my one more question with this pandemic condition, what do you suggest to the old people? The California is really bad situation at this point. We have over 500,000 cases, and of course, a lot of people, they went to the beach and they were not using the mask, and also they were just they were not using actually precautions. So my question is, what do you suggest to our people who live in California and also to the rest of the world in this situation? We definitely wanted to eliminate this disease, pandemic situation. We just want, and I'm hoping we will get the vaccine pretty soon. But what do you wanted to say till we get the vaccine? How we can prevent, how we can do the prevention with this kind of situation?
Yeah, that's a great question. I think the main point I'd like to emphasize is to be socially responsible during well, as long as COVID's with us, just to be socially responsible, wear your mask, maintain social distance, etc. But also to think of health holistically. So COVID is a very, very serious health issue, but there are also so many other serious health issues. Like we talked a lot today about stroke, heart disease, cancer. Also, mental health has become even probably a much bigger issue during the pandemic, as people have been sort of trapped inside, people are now, drinking a lot more and, having more anxiety, etc. But the bottom line is to think of your health holistically and not deny yourself access to health treatment. Health treatment doctors have been working hard throughout the pandemic. And, we're here for you, and, we want to help in any way we can. And we certainly don't want to see people have negative health outcomes because they're delaying treatment for other non-COVID related health issues. But rather, we want to be there and treat you early so that everyone has the best possible outcome.
Perfect. Thank you so much, Dr. Bash. I really appreciate your time, and I hope you will join again sometime in future when we do the program live from the studio. We wanted to do this program from the studio, and unfortunately, because of the pandemic, we couldn't do it. But definitely we'll do it, and I would love to invite you again in our program when we start live from our studio. Thank you so much, and I appreciate. Thanks for joining the program. Thank you.
Thanks for having me.
Thanks. Bye-bye.